Welcome to Chapter 19. Chapter 19 is broken into two sections. This first section, part 1, is the bones. Okay, so our skeletal system is made up of connective tissue. Now, there's 3 types of connective tissue: bones, cartilage, okay, and dense, fibrous connective tissue. All right, so let's talk about bone functions. Now, of course, our bones are the hardest element in our body. It has 5 primary functions to support. So supporting the body, meaning it gives your body framework, it supports the muscles and their ability to attach. Okay, protection. Your rib cage, for example, protects your vital organs such as the heart and lungs. Your vertebral column protects the spinal cord, so that's what we mean by protection. It allows for movement, and blood cells are formed in certain areas of the bones, and it stores minerals such as calcium and the mineral phosphate. Okay, so let's talk about some structural aspects. So ultimately, when our bones, our hard bones, are technically calcinated, and we have 2 types of bones, or two types of bones, right? So we have our compact bone, and we have spongy bone. Okay, so our compact bone make the shafts and ends of our long bones, for example. So, and they're compact, meaning the cells are tight, close together, compact. That's why they're called the compact bone, right? And then the spongy bone has something called the trabecula, which I will discuss as we go through. Within the trabecula is the bone marrow. And then around the bones, we have this connective tissue layer called the periosteum. Okay, so I'm going to go through the long bone anatomy, which is incredibly important. Let's go ahead and start. Here I'm going to zoom in and out so that we can see everything up close. Okay, so the ends of the bones, a long bone that is called the epiphysis. The shaft is called the diaphysis. Okay, now the outer covering is wrapped in the periosteum. Okay, and I'm going to zoom into the epiphysis. Okay, at the end of the long bone, we have hyaline cartilage. So we have this little layer of cartilage right around, it wraps all the way around. Okay. Now, if you look closely here, you'll see this line. This is your growth plate. More specifically, it's called the epiphyseal plate. Okay. Now we said that a long bone is made of spongy bone and compact bone, which is true. So the hard, skinny part right here, this is the compact bone. The spongy bone is called that because it does kind of look like a sponge. And of course, this is the spongy bone right here. This whole area is spongy bone, and then it contains red bone marrow. Now, if we were to cut open a long bone, it has a cavity called the medullary cavity, and it contains yellow bone marrow. Okay, so the anatomy of the long bone is of significance. Okay, next. Now, when we were discussing the hyaline cartilage, I want you to remember what that looks like, and that's from histology, of course. So remember hyaline cartilage. Okay, it's primarily matrix, and then it has these chondrocytes which are mature cartilage cells that sit inside of a lacuna. And remember, the lacuna is this kind of this space that the cell is sitting in. That is what the lacuna is. All right, if we look closer at a compact bone. Now, the compact bone is, let me zoom in here, okay? If we zoom in on the compact bone, there's some very significant information here, but I want to point out the first thing that is of significance. Number one, the compact bone looks like this, okay? It's got these rings, and it almost looks like a tree trunk, okay? And that's what it's composed of. And it technically, and then in the center, it has the central canal. All right, now if we look closer at the sketched out version here, okay, you see each one of these little tree trunk circles, right? These cylindrical structures. This is called an osteon. Okay, so the osteon is that whole unit. And then of course, every osteon has a central canal. And then there's more. If we zoom in even closer, we can see these little tiny structures. And what they actually are is they're cells. They're osteocytes sitting inside of a lacuna. Each and every one of these, okay, all along the compact bone, those are osteocytes. Okay, remember what an osteocyte is, or what the term cyte means. This is back to histology. So these are cells, and very specifically, an osteocyte, okay, is a mature bone cell. And if we zoom in on it, such as in this picture here, this whole thing right here, this is the osteocyte. There's the nucleus, right? And this is what it looks like. And this kind of the location or the little chamber that it sits in is the lacuna. And each osteocyte and lacuna connects to one another through this canalcula. All right, so you want to know, of course, those three structures. Now, the major cells that we see with the bones are osteoblasts, osteocytes, osteoclasts. And the osteon itself is that entire unit right here, osteon. And it's also referred to as the Haversian system. And ultimately, you want to know that anatomy. The other part of that is inside of the central canal, there's vascular tissue and nerve tissue. And notice this, that if we follow this canal downwards, okay, see how it connects? It actually connects to the next osteon, and this goes on and on and on through the entire bone. And then in the long bone, right after, or in certain parts of the long bone, mostly at the ends, well, actually only at the ends, we have the spongy bone. There it is. And the spongy bone has a very distinct shape. And these little hollow areas really are actually filled with the red bone marrow. All right, so that's our anatomy of the osteon, the central canal, and then of course don't forget there's always a membrane holding this all together, spongy bone. Okay, so definitely you want to review these cells: osteoblasts, osteocytes, osteoclasts, and what do those mean again? Now remember, blasts are immature cells, but they're forming the matrix creating. Okay, so if we go all the way back to chondro means cartilage, right? And so a chondroblast is a cartilage forming cell. Cartilage forming. Now osteoblast. Okay, osteo means bone and blast it means that it's young, immature, and matrix forming. And the matrix that it's forming is bone matrix. So this is bone matrix forming cells. These are the cells that build up your bones. Okay, an osteocyte is a mature bone cell, and osteoclast is there to break down the matrix of the bone. And so when your bones are being repaired, for example, or renewed, osteoblasts and osteoclasts are directly involved in the breakdown of the matrix and the creation of new bone cells, and this is happening simultaneously in bone development and the maintenance of your bones. So this is just a quick little review, or just not really a review, just to kind of emphasize what we just discussed with osteoblasts and osteoclasts. So of course we grow and change, and then once you're an adult, your bone cells do get renewed. And really it's dependent on diet and exercise and age, but bones do change their shape and size. And so bone remodeling is partly due to osteoclasts, and then of course osteoblasts are involved as well. Okay, so what happens if there is damage, such as a fracture? Okay, the very first thing that's going to happen is a hematoma. A hematoma will form, and then we have fibroblasts, chondroblasts. These are fiber-producing cells, cartilage-producing cells. They are going to come to the location of the damage. Okay, and they're going to start to build a bond between the two broken bones. Okay, so this is temporary, and then new blood vessels will form as well, and we are in repair mode. Now, eventually, this cartilage is going to start to get to calcify, and then the bone will be remodeled. And the remodeling phase is osteoclasts are going to break that down, and while osteoblasts are delivering brand new bone cells, healing the fracture. All right, let's talk a little bit about cartilage in the skeletal system. Its job is to support. It's to support the bones. Okay, so we have different types of cartilage, as we very well know, but I want to point out a couple. Like, for example, elastic cartilage makes up your ear. Fibrocartilage is a little tougher, and you'll find it makes up the vertebral discs. It's in between each vertebrae. So this is the support we mean. We can't have two bones grinding against each other. Not only is that incredibly painful, it is debilitating. Okay, and then we have hyaline cartilage, which is what we just saw, and it's typically on the ends of our long bones. It's in other locations too, but that is the main place we'll find hyaline cartilage. All right, let's talk a little bit about tendons and ligaments, because these are dense, fibrous connective tissue that is in our system. Now, ligaments, they attach bone to bone. Tendons attach muscle to bone. Okay, we have different types of bones, different shapes. Okay, so we have our long bone, like this. And basically a long bone it's not necessarily always long, like the bones in your arm or the bones in your leg. Most of them are, but why they're called a long bone is because the length is longer than the width. So, for example, the bones in your fingers, your metacarpals and phalanges, these are long bones as well. But they're actually really not that long, but they're long bones, because the fact is that their length is longer than their width. All right, so those are long bones. Then we have flat bones. One great example is your frontal bone. We have irregularly shaped bones, such as the vertebrae. And then we have, this is called a sesamoid bone, and that's your kneecap or the patella. And then we have short bones, such as the carpals. Okay, that's a humerus. All right. Now, in the human body, we have 206 bones. And we break down the skeletal system into the axial skeleton. The axial, okay, is, think of it this way. It's the central axis of the body. So the axial skeleton in the middle there, right? All right, so it's going to be the skull and all of the bones in it, the vertebral column, the ribs, and your sternum. Okay, and so you see the axial skeleton highlighted in blue. Then we have the appendicular skeleton, which is basically your limbs. And so that's going to be the entire pectoral girdle and all of the limbs involved, and the pelvic girdle and all of the limbs involved. So in this image, you'll see the axial skeleton in blue, the appendicular in this off-white beige color. So I'm going to teach you each and every bone up close. This is a great picture to refer to when you just want to, quickly go through the bones from this perspective, but I like to go through each and every bone. Okay, now very, very quickly, I'm just going to re-emphasize where the axial skeleton is, and that's of course, this is the skull, the vertebral column, all the way down to the coccyx bone, and then this entire thoracic cage. All right, so let's go ahead and start. The bones of the skull. Now, the bones of the skull are pretty straightforward. Let's go ahead and start with the frontal bone. So that's your forehead, and it extends back further, and it makes the top of your eye sockets as well. That is the frontal bone. And what's good about these bones actually is that it makes it a little easy to learn these bones, because we've already learned these lobes of the brain. So remember the frontal lobe. Okay, so that's obviously in the frontal. It's protected by the frontal bone. Same thing here. We have the parietal bone. We have a right and left parietal bone. Okay, back here we have the occipital bone. Okay, and then we have the temporal bone. Temporal. All right. Now, let's see. Okay, we can just actually go ahead and continue with this particular image. Your cheek. Your cheekbone is called your zygomatic bone. Okay, your upper jaw. Okay, where that houses your upper teeth, right? That's called the maxilla. Your lower jaw, it's that hinge, this whole structure, that's the mandible. Okay, now if we flip the head over, such as in this view, we can see more bones actually, and we can see the sphenoid bone, and I'm going to show it to you up close. But the sphenoid bone is here in purple. I can trace it all the way around. Okay, and all right. So you want to know the sphenoid bone. From this distance, or from this perspective, we can see another bone too. This is the vomer bone, right there in the middle, and then we have the palatine bone. Okay, so this would be in like the back of your mouth, and then that's still the maxilla. Notice this big opening. This is the foramen magnum, where the spinal cord connects to the brain. Okay, I want to emphasize that the parietal bone is in two parts. Okay, the left side, right side. Same thing for the temporal bone, actually. There's a left and right side, and that's a perfect image of the occipital bone. The temporal bone, if we were to detach it off of the skull, this is what it looks like. And it has the external acoustic medius, which of course is going to lead, this is your the channel that's connected to your auditory canal. Okay, so or not exactly the auditory canal. The auditory canal connects to the external acoustic medius. Okay, so that's important to be able to identify a bone on its own. So if you were looking at the temporal bone, this is what it would look like, and you would see this little zygomatic process sticking out, and this little, I would look for the external acoustic medius and the zygomatic process to identify it. And the zygomatic process, it connects to the zygomatic bone. The sphenoid bone. So you want to be able to identify the sphenoid bone on its own, and I always say that it looks like a bat because it does. All right, so these are two views of the sphenoid bone, and these are all the two views of a real sphenoid bone, and it kind of has these bat-like wings. The ethmoid bone. The ethmoid bone sits in your nasal cavity, and it makes up part of your eye socket as well, and it looks sort of like a little walnut. That is the ethmoid bone. So with these certain bones that I'm pulling out, we need to know what they look like individually on their own and where they are in the skull as well. Now, just to show a little bit more of exactly where these bones are. Okay, frontal bone, that makes up your forehead. Temporal, that's going to be where your temple is, right? And then, I haven't discussed this, but I'll briefly discuss it. You see these little tiny flat bones, so that's your nasal bone, so it's going to be the top of the nose. Your cheekbones, the zygomatic, maxilla, mandible. If we were to detach the maxilla, it technically has a right and left side, and the mandible is one piece, the jaw, the lower jaw. Okay, this is the only bone in the body that is not connected to another bone. And it's called the hyoid bone. It's right on top of your voice box, your larynx. That's the hyoid bone. And it is the only bone that is not directly connected to another bone. Vertebral column. Now, for a class like this, we're going to keep it simple. We have the vertebral column, of course, is broken down into three major parts. We have our cervical spinal cord or cervical vertebrae, and that's your C1 to C7, so there's 7 total. Then the thoracic, 12 vertebrae in the thoracic, and then lumbar has 5. And right underneath the lumbar is, of course, the sacrum, and then the coccyx bone, which is technically in short, your tailbone. And a really good way to remember these numbers, is we have breakfast at 7 a.m., right? Well, not really, but okay, we can just say that. And then we have lunch at 12 p.m. at noon, and dinner at 5 p.m. All right, and then of course we have the intervertebral discs that are in between each vertebrae, which assist with movement, flexibility, and then of course support. Now, this is extra information, but it is important. Your cervical column, or your cervical vertebrae, not every single one, but most of them have a very specific type of body. Actually, your cervical, thoracic, and lumbar. Let's quickly go over this. So this region, this thicker part of the vertebrae is called the body. Okay, now This doesn't have every part of the vertebrae because the cervical vertebrae are a little smaller. They tend to get a little bigger as we go down the line. Now, this tip part is called the spinous process. All right, so let's go ahead and take a look at the thoracic. Okay, now the thoracic vertebrae, they have a very distinct appearance. So the body is kind of heart-shaped, okay? And there's the spinous process on the point that actually, if it was in your body, it would be sticking out backwards. Like, think of, you know, the scales on a dinosaur or something. You know, our spinous process runs all the way down, pointing dorsal. All right. Then we have our transverse process on both sides. Okay, now the lumbar, what makes it noticeable is it has this oval shaped body, okay, and then it has this triangular vertebral foramen. Notice the vertebral foramen over here on the thoracic, it's round. All right, so these little tiny distinctions is how you learn to identify bones and recognize them, and recognize a thoracic versus lumbar versus cervical vertebrae if presented with it. And then, of course, that's the spinous process, transverse process. Now, the sacrum is pretty interesting. If you look closely, there's 1, 2, 3, 4, and technically 5. These are actually 5 fused vertebrae. So they are fused, and that's why you can see these little holes there, right? And that make up the body of the sacrum. Now, at the very bottom, these are also fused bones. 1, 2, 3, 4 fused bones, and that's your coccyx bone. Okay, so let's talk about the rib cage and the entire thoracic cavity, the ribs and the sternum. Okay, so the ribs are very easy. We don't, in this class, for 107, I don't have you actually, if it's a rib, yes, you need to know that it's a rib, but I'm not going to ask you, is it, you know, the rib number 3 or rib number 12? That's, you know, a little out of the scope of 107. However, we do have 12 pairs of ribs, and, okay, notice that these ribs are called 1 through 7. They're called true ribs. Why are they called true ribs, and why are these called false ribs? It's as simple as this. These ribs, from 1 all the way to 7, notice that on one side they're going to connect. They connect to the vertebral column. They wrap around and connect to part of the sternum. Now, while we're at it, before I go any further, let me show you the sternum. Okay, this is the sternum. I'm going to trace it around, and it goes all the way down, okay, to here. And the 3 parts of the sternum are, the top is the manubrium, this is the body, and this little dagger-looking structure is called the xiphoid process, making up your chest plate, your breastbone. Okay, so it's 3 bones that are fused together that make up the sternum. Okay, back to the ribs. Now, the ribs are connected on one side to your vertebral column, and on the other side, they're connected to the sternum. Well, the true ribs are anyways. Okay, so notice that each and every one of these ribs with the true rib is connected to the sternum. Okay, now the false ribs, they are not directly connected to the sternum. In fact, they're connected to quite a bit of cartilage, and so they actually, if I were to show you exactly where they end, they do end like right there, and the rest of it's cartilage. That's why they're called false ribs. And then of course we have these, the 12th rib is the floating rib. Alrighty. But okay, so we have 12 pairs of ribs, true ribs, false ribs. And then the sternum, you want to know those 3 bones, the manubrium, body, xiphoid process. Oh, my goodness, I almost forgot. Don't forget, this cartilage is called the costal cartilage. All right, let's get going here with the appendicular skeleton. The appendicular skeleton is going to be your pectoral girdle. Okay, so I'm going to show you exactly what that is. It's your shoulder, your clavicle, your scapula, your upper limbs, so your arms and your wrist and hand, the pelvic girdle. So of course this is the pelvic girdle, and I'm going to show you in detail, like I said, and then your lower limbs, your leg, ankle, foot. All right, so we're going to go ahead and start with just a refresher, axial versus appendicular. And this is a great picture to study, but I like to look at the individual bones, and I like to look at each and every bone individually. Now, really quick, let's point out a couple of things here. Actually, no, I'm going to move on. This is a picture for you guys to study. This is the anterior view. This is the posterior view. Let's go ahead and start with the pectoral girdle. So I want you to note this. You may or may not already know, but what does pectoral mean? Okay, that's your chest. That's your pec muscles. It's always in reference to a location, which is the chest. All right. Now, the pectoral girdle is this entire structure here, and we're going to get close. We're going to look at each and every bone, but I want to first introduce them. This is your collarbone, okay, called the clavicle. All right, now this is the shoulder blade, which is part of the girdle, and that's this called its technical name is the scapula, of course. And then your upper arm is called the humerus. And a good way to remember that is if you have you ever hit your elbow real hard and it goes numb, and they call it your funny bone. They call it the good way to remember is that is your humerus. It's funny because it's so humorous. All right. Next, your forearm is composed of 2 bones, okay? Your radius, okay, your radius, if you follow this down, boom, connects to the thumb. Ulna, okay, follow the ulna, it's going to connect on the other side to where technically your pinky would come in eventually, but not before. Your carpals, your metacarpals, and your phalanges. All right, let's look closely here. Now, here's the deal with the clavicle. It has a very distinct S shape, okay? And one side of the clavicle connects to the, one side connects to the sternum, the other side is going to connect to the scapula. And so this is the end that's connected to the sternum. Thankfully, it's very clearly labeled and called the sternal end. This is the acromial end, which connects to the actual, connects to the, what is wrong with me? The shoulder blade. Okay, now anyways, now I want you to be able to recognize bones on the body and individually, and this has one shape and one shape only. See how it's flat on this side and blunt on this side, and it makes this very particular S shape. That is your clavicle. Okay, the scapula. The scapula is your shoulder blade, and technically, okay, so of course your upper arm, your humerus. Let's zoom in on this little guy right here. Okay, the scapula is highlighted, and it's definitely showing right there the humerus where it connects. Okay, and that is the glenoid cavity right here, and ultimately the acromion here is where the sternum connects. Acromial and acromion. That's why it's called that. All right, now either way, there's, with the bones, there is no two bones that look the same. They are completely unique, and you have to find these little things about them, shapes, ways to remember them, and remember that to identify them. All right, so we just talked about the clavicle. Now the scapula, there is no other bone that looks like this. It looks like this triangle, and yeah, it has parts sticking out, but at the end of the day, it's a triangle, and that's a great way to remember it. Okay, now this is where we talk about the pectoral girdle, because what makes the pectoral girdle is, of course, the clavicle bone, and you see here on one side it's connected to the sternum, on the other side it's connected to the shoulder, the scapula, right? And then, of course, the humerus. This is the head of the humerus sitting in the glenoid cavity. All right, so all of that together is the pectoral girdle. Now let's look at the humerus. No other bone in the body looks like the humerus, only the humerus. And it has a head, and then it has this, it's kind of a neck. It has this, it's not actually really a great neck, but it's a neck. And it also has this structure called the greater tubercle sticking out. But the best way to really identify the humerus is with these condyles. See these structures down here? Yeah, you won't see it on other, you'll see something similar, but no other bone looks like the humerus bone. Okay, now where the humerus meets the radius and ulna, this little area right here is called the trochlea. Well, actually, that's the side that meets the ulna. Okay, now this is the head of the radius. So if we went further, that would be your thumb. Okay, and then and that's with your hand sticking. If you were putting your standing straight and palms out. Okay, and the trochlea connects to the ulna. Okay, and so that's one angle, and then this is the back angle. Okay, see the ulna right here? It's hooked on. It hooks on to the trochlea. And if you look at the head of the radius from this angle, it makes a perfect circle. And a great way to remember the radius is to think of a circle. Okay, and because remember, half of a circle equals radius, or radius equals half of a circle, and that's a great way to remember the radius. Okay, now this is a closer look at the ulna, and unfortunately I don't have them disconnected, but it's completely fine. And a great way to remember the ulna, so I just gave you an example of how to remember the radius, because the distance between the radius of a circle, using the circle as an example. Okay, so because if I were to face that towards you, it would make a perfect circle. And think of a straight line from the center point to the outside, and that's the radius of a circle, right? Okay, now how do you remember the ulna then? Because really these bones are, I can recognize them, but I want you to be able to recognize them, but they're sort of the same length, right? So this is how you recognize the ulna. Okay, this little hook right here makes what shape if we turn our heads to the left? It makes a U shape, right? U for ulna. So that is how you should remember the ulna. Okay, so let's kind of recap our little fun ways of remembering the bones. Okay, your humerus is your funny bone. The radius, the head of the radius makes a perfect circle, and half of a circle is radius in math. And then the ulna has a hook, and if you turn it sideways, it makes a U for ulna. Next, okay, if this thing will cooperate with me here, we can move on to the next slide. Okay, does it want to? All right, so we'll move on. Now we're still looking at the radius and ulna from several perspectives, and I want you to see both sides. So with the back of the ulna, you're not going to see the U. You'll see it because technically, remember, it hooks. And then there's our radius. All right, so this is the right forearm. I don't understand. I'm trying to flip. There we go. There's our U. Okay, this is the ulna, and we're really, really zoomed in here. And I just want you to be able to recognize that bone. Even after you guys go on and go to anatomy and all of that, this is a really quick way, because in anatomy, not only do you have to know the bones, but you have to know markings on the bones. However, this is a great way to always remember the ulna. Okay, let's move on. Bones of the hand. Bones of the hand are really easy because you guys are literally just learning this kind of rhyming situation, okay? Now, your wrist, there are many muscles here, and I'm not going to teach you all the muscles because in 107 we keep it simple, and these are simply called your carpals as a group. Yes, each one has a name, but they are called your carpals. So think of carpal tunnel, right? People that have carpal tunnel, they have an issue in their wrists. Okay, so right above that, these bones are your metacarpals. Okay, metacarpals. And then phalanges. And we technically, all of that is your phalanges. And there are three parts of proximal, middle, distal phalanges. So it's easy. Carpals, metacarpals, phalanges. Okay, let's move on to the pelvic girdle. The pelvic girdle is going to be the entire coxal bone, which is the basically your hip, okay? The biggest bone in the human body, the femur, and then it's going to be the lower leg, the tibia and fibula, and then the tarsals, which are your ankle bones, metatarsals, phalanges. All right, now there's a lot to learn here because this pelvic girdle is the whole thing is the pelvic girdle. Okay, so like half of it, or just looking at it just at one, right? This is called the coxal bone, and in this particular part of these bones are insignificant, and I do actually have you learn a couple of markers because this bone it has three parts. Okay, the upper part is the ilium. Okay, this little ridged part is called the pubis, and this is called the ischium. And there's, of course, two. And one side connects to the sacrum for both hips, right? And then they connect on either side of the sacrum, the right and left. And then they fuse together here at the pubic symphysis. The pubic symphysis is, of course, cartilage. And I want to point out another marker that's incredibly important. See this kind of ridge, and then it has this texture. You can even see it in the picture. That is called the iliac crest. All right, so I want you guys to know the ilium, which is highlighted in this yellow bone color, the iliac crest, which is a bone marking. Okay, the pubis, which is this whole piece in red, and then the ischium, which is all in green. Okay, oops, there we go. Okay, now comparing the male and female pelvis, of course, what's happening here is that the pubic arch is significantly different. It's significantly different because of the fact that female bodies were adapted for childbearing. Therefore, the cavity in the pelvis is more shallow. So basically the arch is more rounded and it's less of an angle. And then the male pelvis has a higher arch or a greater angle. Now, this is the biggest bone in your body. It's your thigh bone, and it's called the femur. Now, nothing else looks like the femur, not even the humerus. Even though there are some similarities, here's the big difference. First of all, this bone is much larger, but picture-wise, this is what you're going to look for. See this perfect head and this long neck? And then we have the greater trochanter, which is that marker, and then this little thing sticking out called the lesser trochanter. But that is how you recognize the femur. Look for this little perfect little ball. All right. Then your shin is made up of two bones. The primary shin bone is the tibia. The tibia is kind of flat and has these two little. This is actually where the femur sits right into these two areas, but either way. Okay, so the tibia is your shin bone, and the fibula is a supporting bone. So it's kind of flat on the top, and then see this little point down here? It has this little it just sticks out. Okay, that's how you recognize the tibia, and you can look for these markings as well, that one. Okay, the fibula. The fibula is this skinny bone. So all of your weight is coming in like this and sitting on your tibia, and it supports the whole body, all the body weight. And then so it has this little assistant, and that is the fibula, and it's skinnier, and of course they're connected through a membrane. Okay, your ankle. Tarsal. So it's similar to carpal, metacarpal phalanges, except these are tarsals, metatarsals, okay, and then phalanges. Bones are actually easy. You just have to study them. All right, let's talk about joints. Joints are technically referred to as an articulation. Okay, this is where two bones connect. Two bones come in contact with each other, and based on what type of joint it is will define how much movement you will have in that particular joint. Okay, now there are certain joints called fibrous joints which are completely immovable. Okay, an immovable joint is the pubic symphysis. You cannot move that. Inside of our skull, we have joints where those lobes connect. Those are called sutures. These are joints. You can't move that either, right? Of course not. Okay, so that's easy enough. Slightly movable joints are going to be cartilaginous. Okay, and something that's slightly movable, of course, is your vertebral disc. I mean, it's not the most, you can't just, you can move it to an extent, right? You can move your vertebral column to an extent without hurting yourself. That's what we mean by slightly movable. Okay, now the other things that are freely movable and are going to be, these are called synovial joints. Your synovial joints, okay, are your shoulder, okay, and your knee, your elbow, and they're called synovial joints because they have this synovial cavity. All right, synovial joints. Okay, let's talk about that in detail. Now let's look at the shoulder. It's actually, let me cover a couple of things real quick. Now, this is a capsule, a joint capsule. There is tons of actually different types of synovial joints. There's a ball and socket, there's a hinge, and there's actually 6, but am I teaching you? No, you know what? You learn those in anatomy, so we'll just keep it simple. All right, so let's talk about the joint capsule. Now, I'm going to just go through it because it's the best way to do it, to learn this. Okay, here's the whole joint. Now, remember, this is where two bones meet. Now, this periosteum that surrounds this bone is going to turn into this membrane. Okay, this is bone 1 over here. This is the second bone. Okay, and inside we have something called the synovial membrane. Okay, then that periosteum is going to turn into this articular capsule. And of course, each bone has its own cartilage that lines the ends, and that stays in place. And then this whole joint is filled with something called synovial fluid. And that synovial fluid lubricates the bones. Now, these two bones, the movement it is absolutely necessary to have a synovial joint between bones like this, because of the friction between two bones could actually, do a lot of damage to each bone, and therefore your body's designed to prevent that. Okay, now we can look at this quickly. This is also a synovial joint. Clearly, the shoulder is very sensitive. The shoulder is it's a ball and socket joint, and so is your hip. But because of the way the femur's head has this perfect ball for the ball and socket joint, it's more sturdy. Unlike the humerus, which has a head, but it doesn't have this super narrow neck. And so we have this entire cavity and joint designed to hold your shoulder in place. There's muscles involved, okay, and there's tendons, and there are ligaments, and there's quite a bit holding the shoulder in place, but it's not as sturdy as the femur, falling right into the hip joint. So this is why a lot of people pull their shoulder out of socket and injure this area, because it is not the most stable joint. All right, now these are different types of movements, and I want you to mimic each movement. And I know it looks silly and it feels silly, but I want you to do it anyways, because normally in class I would do it, but we're not in class. So I want you to practice this. You bring your head down. When you bring your head down, that's flexion. You're flexing muscles. When you bring your head backwards, that's extending. You're extending muscles. Okay, same thing with your foot, flexion, extension. Okay, and ultimately flex your bicep, right? Flexion. And I want you to look at your arm, this part of your arm. See how it makes an angle? Okay, so flexion decreases the joint angle. Now put your arm straight down. There's no angle. Think of, math class. Okay, the joint angle increases. Okay, this is very simple. Abduction means you're moving something away, like think of abduction by aliens, right? It's taking you away. Okay, so when you move your arm out or your leg out, that movement is called abduction. And really, you're moving it away from the midline, which is the center. This is your midline. Okay, adduction, ADD. Okay, think of you're adding something, and really what's really happening is you're bringing it closer to the midline, your arm, your leg. Okay, rotation, you move something in a perfect circle around its own axes. Okay, these terms are important and are not very clear. Supine. Being supine or supination is when your hands are facing downwards. Okay, the hand faces anterior or downwards. Okay, pronation is when the hand faces the palm faces posterior or downwards. So supination and pronation. Think of the supine position or I haven't really heard the term propine too much, but supination, pronation. Inversion is when you turn the sole of your foot inwards. Exversion is when you turn the sole of the foot outwards. Inversion and eversion is not just in reference to the foot, by the way. It's just describing types of movement. All right, let's talk about disease. I'm going to just quickly review these. A sprain is if you stretch or tear your ligament. Tendinitis and bursitis. Okay, I didn't talk too much about the bursa, but the bursa is part of joints. That's when that becomes inflamed. When the tendon becomes inflamed, that's tendinitis. Arthritis. Arthritis is very common, very painful inflammation of the joints. We have osteoarthritis, rheumatoid arthritis, and then we have osteoporosis. So think of it like this. Osteo means bone and pores means a pore, like a hole, right? And really you can, look at it that way and imagine, the bone is losing, sorry, that's a terrible bone, but it doesn't matter. It's losing its own tissue, becoming aka porous. Okay, that is the end of the bone section for this chapter. And then next is the muscles.